voltage gated sodium channel blocker that we have, it is going to be Valproate. These are the drugs. I have just pre-written it just to save some time here. We have Valproate, lamotrigine, phenytoin, carbamazepine, lacosamide, rufinamide, topiramate, zonisamide. Now there are a lot of drugs. The problem comes, how will you remember? For that only we are here, right? We'll help you in remembering these names in one click, right? So Valproate, remember, I'll give you a very simple story. You can remember them by the very simple mnemonic here, that is known as your very lame Bollywood actress. Let's say the name is Priyanka Chopra. I'm pretty sure all of you guys are aware and a fan of her. Very lame Priyanka Chopra likes rough and tough, and she got married to Jonas. So rough and tough Jonas. Zonisamide is Jonas. Just a way to remember. And a very lame Priyanka Chopra likes rough and tough Jonas. Very easy, and it's a story, right? So very Valproate, lame will be lamotrigine, Priyanka Chopra phenytoin, carbamazepine, right? Likes will be lacosamide, rough will be rufinamide, then topiramate and zonisamide, right? Too simple. Now, all of them are actually voltage gated sodium channel blocker, but in addition to that, they all have some additional property as well that I will be discussing as I proceed in this chapter. All of them are having anti-epileptic property. All of them are having some additional properties as well, right? So voltage gated sodium channel blocker, that is mechanism of action. In addition to that, they have some additional mechanism of action, which I'll be talking, right? In addition to that, I told you they all are also having some additional uses as well, So phenytoin is one of the oldest anti-epileptic drug. It is non-sedative anti-epileptic drug. Lacosamide and rufinamide, on the other hand, is from the newer area. They have different mechanism of action. For example, rufinamide is one of the voltage gated sodium channel blocker. It is also one of the mGlu5 receptor blocker. Rufinamide, it is voltage gated sodium channel blocker. In addition to that, it is also one of the mGlu5 receptor blocker. So what was mGlu5? It was the receptor of the glutamate. Lacosamide, it is one of the voltage gated sodium channel blocker. I think we are discussing this already. In addition to that, it is also one of the CRMP protein inhibitor. So what is the name of a drug that is one of the CRMP protein inhibitor? Lacosamide, है ना? Lakme wala cream, lacosamide. Lakme cream, lacosamide, CRMP protein inhibitor. Topiramate, zonisamide, they both are associated with renal stone and weight loss. Both of them are associated with renal stone and weight loss. The weight loss by topiramate is statistically so significant that topiramate, it is approved as an anti-obesity drug. Zonisamide also causes weight loss, but that is statistically not very significant. These are some of the important questions that we had. Valproate that we have, it is among the older anti-epileptic drug, and among the entire list, this is considered as the most teratogenic anti-epileptic drug. Most teratogenic anti-epileptic drug, and all the teratogenicity about these drugs I have discussed already in general pharma, right? So maximum teratogenicity is Valproate, right? They are associated with a condition known as your spina bifida, one of the neural tube defect known as your spina bifida. So one by one, let's talk about these drugs. Okay, first drug that I would like to talk about is known as your Valproate. So I told you they all have different mechanism of action. So important mechanism of action of Valproate, undoubtedly they are voltage gated sodium channel blocker. This is responsible for their anti-epileptic property. Do you guys know that it is also having they are going to release the glutamate? That is one thing. Decrease the glutamate release. And it is also having one more important property. It also acts as a GABA transaminase inhibitor. What is the role of GABA transaminase TR inhibitor? I'll be telling you. They are also having GABAergic property. But remember, they are also having a very important role, that they are actually T-type calcium channel blocker, transient type calcium channel blocker. This explains the fact that why this drug, it is also utilized in absence seizure, because I have shown you in absence seizure, the pathophysiology of absence seizure, there is involvement of T-type calcium channel. Okay, so Valproate is a drug that is acting by multiple mechanism of action. Important ones that I told you: T-type calcium channel blocker, voltage gated sodium channel blocker. They are the two important ones. Now let's talk about few important points about Valproate. that do you guys know that valproate is a drug, this is considered as a very, very potent enzyme inhibitor? So valproate is a older anti-epileptic drug. It's a potent enzyme inhibitor. Among anti-epileptic drug, most of them are what? Inducer. This is the one that is your enzyme inhibitor. Now their uses, they are actually utilized in multiple seizures. Plus, they have lots of non-epileptic uses as well. So we have to see this one. They are going to be utilized in a patient with the generalized tonic-clonic seizure. Among generalized tonic-clonic seizure, they are among the first line. They can also be utilized in a partial seizure or focal seizure, focal seizure, and they can be utilized in other condition as well, like atonic seizure, clonic seizure, myoclonic seizure, atonic, clonic, myoclonic seizure, Lennox-Gastaut syndrome, a condition which is characterized by recurrent epileptic episode, right? So this was in the miscellaneous class we have discussed. It is characterized by recurrent epileptic episode. Okay, so for all of them, that is atonic seizure, myoclonic seizure, Lennox-Gastaut syndrome, and there is one more by the name of Dravet syndrome. There is one more by the name of Dravet syndrome. For all of them, the drug of choice will be none other than your sodium valproate. Sodium valproate, it happens to be the drug of choice. But as I said, that they have lots of non-epileptic uses as well, which I'll be writing here. Under uses only, I'll be writing here. So what is the meaning of non-epileptic uses? That means apart from epilepsy, as simple as that. So they can also be utilized in a prophylaxis of migraine. That is very good. In a prophylaxis of migraine, we can use them. They can also be utilized in a bipolar disorder. And if you remember, we have discussed in a bipolar disorder, there is a condition called rapid cycler, where the patient is having mania and depression more than or equal to 4 cycles per year. In a rapid cycler also, they are the drug of choice. Who is the drug of choice? Valproate is the drug of choice. They are also considered the drug of choice in a patient with the Sydenham's chorea. For Sydenham chorea also, valproate is the drug of choice. Now see, valproate is a very, very effective drug. So they are utilized in a prophylaxis of migraine. They are utilized also in a bipolar disorder and also for Sydenham chorea. Another thing that you should know about valproate is the therapeutic plasma concentration level of valproate. Therapeutic plasma concentration level of valproate is going to be 50 to 100 microgram per ml. 50 to 100 microgram per ml is the therapeutic plasma concentration level of valproate. So if you see, they are used in multiple epileptic condition, non-epileptic condition, and their therapeutic plasma concentration is around 50 to 100 microgram per ml. Beyond that, you should start titrating the dose. When you look at the side effect of valproate, you can remember it very easily by a very simple mnemonic of valproate. So the simple mnemonic of valproate says that it can cause vomiting, nausea and vomiting. Alopecia, this alopecia is going to be reversible in nature. It is going to be reversible in nature. It's a highly hepatotoxic drug, and fulminant hepatitis, it happens to be a very dangerous, or we call it as a grave side effect. It can lead to another problem like pancreatitis, bone marrow suppression leading to pancytopenia. A retention of fat that we have, it is going to cause weight gain. This weight gain can be there in male and female as well. Because of the excessive retention of fat, they can even lead to polycystic ovarian syndrome. And this polycystic ovarian syndrome, guys, it is one of the gender specific side effect of valproate, one of the PYQ. So which of the following gender specific side effect of valproate? The answer is in front of you. It is going to be polycystic ovarian syndrome. It can lead to peripheral edema as well, or you can also remember O for obesity, because weight gain is going to cause obesity. Another thing that they can cause is anorexia, tremor, teratogenic drug, maximum risk among the anti-epileptic drug, and it's a very, very potent enzyme inhibitor. It's a potent enzyme inhibitor. Okay, lot of important information that we have in this one, right? For valproate, 2 important slides is summarizing most of the thing. Now if you can remember all of them, there is nothing better than that. But if you can remember a very simple story that I'm going to tell you, that will be more useful for all of you guys, and you will remember without forgetting anything. Okay. Now, if you remember, I told you that Valproate is a older anti-epileptic drug, and it's like the old grandfather in the family. So I am comparing this Valproate with the old grandfather in the family. Old grandfather, why? Because old grandfather, he is very senior, highly experienced. The old grandfather in the family, he know how to do one work via multiple ways. He can do one work via multiple ways. So it can increase the GABA level, it can decrease the sodium channel, it can block the sodium channel, and is also having T-type calcium channel blocking property. The old grandfather of the family will be effective in all the familial work, familial advices, taking care of the grandchildren's, plus they can also take care of the society. So extra familial work out of the home also, right? They can be effective in headache, bipolar disorder, है ना, Sydenham chorea, old grandfather of the family. And let me talk about this old grandfather of the family who is there in the age group of 50 to 100. The age of the old grandfather that we have is around 50 to 100. Old grandfather right now who has lost his hair, who is now having tremor, gained weight. When he was young, right, he used to have few shots of drinks, and because of that his liver and pancreas both are gone. है ना, liver and pancreas both are gone. And if you try to go out of the way, if you try to go any left and right, है ना, if you try to deviate from your goal, he will always hold you out, है ना, he will always inhibit you. No, don't go there, don't go there, he will always inhibit you, stop you, right? Now remember about this old grandfather, and if I ask you a very very simple question, that can you summarize the important side effect of valproate? I think just by recalling and looking or hearing the story of the old grandfather, you can say grandfather lost his hair, gained some weight, है ना, liver, pancreas both are gone, है ना, potent enzyme inhibitor, है ना, all of them are going to be summarized in a very simple way. Now, if I ask you what was the age of the old grandfather in my story, so all of you guys are already aware, sir, the age you mentioned was 50 to 100. That is the therapeutic plasma concentration, effective in multiple conditions. Now, in the generalized tonic-clonic seizure, remember, it's among the first-line drug. Earlier, it was used as the drug of choice also, but now it is being replaced by lamotrigine. We are still using it among the first line drug. If lamotrigine is not there, or if we cannot use, if there is any contraindication to lamotrigine, we can use valproate again. Okay, so I think you can easily remember valproate, different uses.